It's a very important European meeting for us as a company, and I've, being a practicing ophthalmologist myself for over 25 years, know how important ESCRS has been in the growth of education in our profession, and for me personally in terms of being a meeting participant over all these years. As you know, Heather, eye health is an important category, and I would argue it's even underserved. About half of the world's population needs some sort of vision correction treatment, and maybe 10% of those people actually receive it. It's not news that cataract surgery is the #1 cause of treatable blindness in the world. What is, I think, being increasingly recognized is the importance in the world of surgery that dry eye, for example, plays in ongoing health of patients and creating the best possible surgical outcomes. Probably about 340 million people in the world have dry eye, and there really is, at this point, not a standardized global consensus around treatment algorithms and paradigms. One of the things that we're proud to be bringing in the near future to the EU is our dry eye product portfolio. We call it the LipiScan, LipiView, LippeFlow, which LippeFlow is LipiScan and LipiView are a diagnostic instrumentation to detect meibomian glands in the eyelid, and meibomian glands are where of course, meibum secretions are supported. And if you look across the dry eye population, about 2/3 of them have significant clinical evidence of meibomian gland disease. So an effective meibomian gland treatment with a thermal pulsation approach like LippeFlow is a very welcome addition to the therapeutic armamentarium for most physicians and surgeons, I think. We have grand plans, which I don't think we have time to talk fully about in terms of how Johnson & Johnson wants to grow in eye health. We want to be the world's leading eye health company. We want to be with patients on their journey from the beginning to the end of their lives, from the early years when teenagers and young adults consider contact lenses to the middle-age years, millennial to middle-age years, where one might consider refractive surgery or need dry eye therapy, and then later in life, of course, we're a leading provider of cataract surgery products. What I think is very exciting at this meeting is the breadth and depth of data we're presenting on our presbyopic IOL platforms, most specifically our TECNIS Symfony extended range of vision intraocular lens, which, as I think you know, employs extended depth of focus technology to allow expanded range of vision for patients while maintaining excellent visual acuity and contrast sensitivity. And many of these studies are showing that this platform is very competitive with other presbyopic IOL options from a variety of standpoints, whether you look at visual acuity, contrast sensitivity, intermediate and near vision, and last but certainly not least, patient satisfaction.